And we'd just really like to thank Dr. Rossman for joining us today from Chicago in the middle of the night, I think. So over to you, Dr. Rossman.
Thank you. Let me just start sharing my screen. Okay. So thank you. It's very nice to be here in your morning, the middle of my night, to talk to you about community-led and community-level zero COVID. But I just wanted to start by saying that, well, I guess the first thing I'll say is gotta get my slides moving here. Okay, so I just wanted to start by saying that as a virologist, I am absolutely shocked to have to be here today. I am shocked to be here trying to talk about why an elimination strategy for a pandemic causing virus is a good idea. This is an absolutely shocking thing. You know, the UK government every year sends teams to infectious disease outbreaks around the world, working with other countries, governments, local communities to contain and stop infectious disease outbreaks. You know, in 2014, the UK government sent many teams to West Africa to combat the Ebola virus epidemic. Now, they showed up there with the goal of elimination. They worked with the local governments, they worked with the local communities, and it was not easy, but they achieved elimination. Now, imagine what that would have been like if the UK government showed up in Sierra Leone, went down to some local communities and said, we're here to help. We're going to help mitigate the virus, and but you're going to have to live with the virus for ever, because we don't think we're going to be able to eliminate it. I don't think that would have been received very well, either internationally or from the local communities. But of course, I know you're saying, okay, well, COVID is not Ebola virus, and that's true. Ebola virus only killed 15,000 people over 45 years, where COVID has already killed over 2.5 million people in the past 14 months. So from my perspective as a virologist, this is the case for an incredibly strong effort. This is why we need a zero COVID strategy. We need to be taking strong effort. And of course, zero COVID is possible. If you look at cases around the world, you see countries that are at or near zero. So this is absolutely possible. And this is what we're looking at. Compared to the continuous cycles of lockdowns that we're all experiencing, this looks so surreal, but it is possible. And so what we're talking about here is zero COVID strategies. And zero COVID strategies are great from a public policy stance, from government actions and a top-down stance. But you can also focus on zero COVID from the bottom up. Communities need to be an integral part of the zero COVID strategy, both by being supported by the governmental policies, as well as leading and taking charge of many of the zero COVID actions. So, for instance, much of zero COVID in areas where there's very high case levels needs to have some level of short, stringent shutdowns that are supported. But this is when and where needed. So this takes into account the local context, because in any country, you're going to have some areas that might have very low cases. So if you're looking at a community level and understanding what the virus is doing in that community, you're already starting ahead of the game. We're talking about closing non-essential indoor spaces, but we're doing it in a supported way. That's another crucial part, is that you're not just coming in and saying, we're focused on the virus, we're focused on the communities. And that means supporting the communities through these measures, whether that's financial support, whether that's childcare support for essential workers. It's a supported system. Now, we need a find, test, trace, isolate, and support system. But the contracted out system that we've been experiencing is not working. We have a very good local NHS system that can be used on a community level to support find, test, trace, isolate, and support. And that can further support individuals that have to isolate because they're testing positive. And it can include widespread testing, but done on a community level. Of course, we need vaccination. Vaccination is a great tool. It's not the end all or the be all or anything that we can solely rely on, but it's a very important tool. But we also have to message and engage communities and support them. That means talking to people about what to expect, about what they need to do, wearing masks, social distancing, but also where they can get support and what kind of support they can get. We need to be working with individual businesses and schools and organizations so that when people go back to work in person, when schools open, we can minimize virus transmission as much as possible. We need to be providing community level support, and that includes support for patients experiencing long COVID, for the marginalized communities that have been disproportionately impacted by the pandemic. And importantly, we need transparency. We need transparency at a local level, and we need transparency at a national level. People need to regain trust in the actions that they're being asked to partake in. And we need to form green zones. We need to form safe spaces that have travel restrictions, that involve testing and supported quarantine for new arrivals and people crossing the border. But this doesn't have to be just at a country level. This can be regions. This can even be individual towns. And importantly, zero COVID is not just an endpoint. Zero COVID is a strategy and a journey. And every step towards zero COVID helps support communities. This is not a big gamble that we're just hoping works out in the end. Each of these steps helps support communities. And we can do this now. Cases in the UK have been dropping dramatically. If we look in Scotland, we have even lower case numbers. This is a really good time to be working on zero COVID, to be getting those case numbers continuing to go down to zero and then keeping them there. And this does not have to just be national. Hopefully it will be. But this can also be local, because when you look at the case rate throughout Scotland, this is not uniform. And if you dial into any one specific area, for instance, you look at the Highlands, actually many areas within the Highlands are already zero COVID. So in a lot of respects, we have a head start. We have a lot of areas that already have zero COVID. We have decreasing case numbers. And we actually have some governmental statements actually finally starting to talk about elimination. So if we can work by combining that top-down policy with the bottom-up community support and community engagement, we can have a very effective zero COVID strategy that can give us something that is so much more positive than what we have all been experiencing for this past year. So thank you very much for listening, and thank you to all the supporting organizations. Thank you.